Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures Taking Stock in You, and we're coming at you live from the Scottsdale Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. If this is the first time you're tuning in, our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening right here, not to me, but to these extraordinary guests I have in the show. And today's no different. I have an extraordinary guest here on the show. And this gentleman has been on now for the 5th time. Can you believe it? 5 times, Steve Sckolnik.
Bob, I don't think that says much about me. I think it says more about the dearth of guest opportunities in this area.
Oh, thank
but
you.
Nevertheless, I feel honored to be back here.
Well,
so
thank
you for having me.
Thank you for donning our studio. You were first here in October of 2019.
Yes.
Actually, 2018. Mm-hmm. And then you came back November of 2019. You were here in October of 2020. And then February of 22, and now 23.
Visiting you is like the annual dental checkup. You get a little nervous beforehand, but then at the end, you're happy you went.
Well, I'm glad you said that. And if you wouldn't mind, for our listeners, Dr. Stephen Sckolnik, who's a radiation oncologist with the Arizona Center for Cancer Care. That's who you are, but can you give our audience just a little brief background on you?
Yeah, absolutely. I'm Scottsdale raised. I went to public school here at Desert Mountain, go Wolves, and went away for about 15 years for my training in Chicago and Tucson, doing medical school and residency and fellowship, and then I came back and joined a private medical and radiation oncology practice, really treating the full spectrum of cancer care. We're based out of Scottsdale, but we have offices all throughout the Phoenix and Valley area. And we're partnered with Honor Health, large hospital system here. So I've been here for almost 8 years now, and I think it's been a very interesting time, to say the least, to be a healthcare provider, not just in America, but in Phoenix specifically. I think we've seen a lot of interesting changes in the healthcare landscape for all patient populations, but specifically the senior patient population. So the stories I could tell you about how things have changed and how things have evolved over the years, it's really been exciting to see, from our perspective, because what I could say is the things that I learned during my training, my residency and fellowship that 10 years ago were state of the art and the most up to date, nowadays might be considered obsolete. Yeah. So, cancer care is an exciting world that's progressing, and it's good for our patients in the sense that we can give better treatments. We can give treatments with fewer side effects. Patients are living longer and happier. So it's an exciting time to be a doctor, but also to be an oncologist, and I think to be a patient as well. So that's kind of who I am.
Well, I mean, the innovation that is really being developed right here in our backyard through Honor Health, and certainly with the Arizona Center for Cancer Care, is extraordinary. And not only have I learned from you and the 4 other shows that we've had over the last, call it 5 years, I've learned it from other docs as well. And you being a radiation oncologist, I mean, this is I would say a non-invasive, but it is invasive, but it's not cutting.
Correct.
You know what I'm saying? So
we often call it the invisible knife, and it's a bit of a misnomer to call it surgery, but in a way it is. It has the effect of killing off a cancer. If you take the prostate, for example, sometimes we remove the prostate when a man has prostate cancer. Sometimes we leave it intact and treat it with a non-invasive, invisible beam of X-rays or radiation. And you and I were just talking before the show a little bit about how these treatments have changed. And when I started working here 8-9 years ago, every man who had prostate cancer routinely received 9 to 10 weeks of once-a-day treatment, and those treatments could be 30 to 45 minutes a day. So you're talking about making 40 to 50 visits in. And nowadays, the majority of our patients are having their treatments done in just 5 visits, 5 sessions. Same cure rate, better quality of life, fewer side effects, better function afterwards. So it's really a tremendous transition. It's better for the patients. It's better for the doctors. The whole kind of healthcare ecosystem benefits from this evolution. And as excited I am of what's happened over the last 5 years, I'm especially looking forward to and excited for what the next 5 or 10 or 15 years are going to look like. And I think, I'm young, I'm 38, but I think my career is going to look significantly different 10 years from now. Mm-hmm. And, I think you've experienced the same phenomenon, home healthcare. Certainly what you're doing today is very different than the kind of care that Cypress was delivering 5 or 10 years ago, and you see the benefits for your patients.
It's funny you say that, and I don't get a chance to talk a whole lot about Cypress, and you and I have become friends over the years, and you couldn't have hit the nail on the head any more solid than you did just that. I mean, the times have changed, especially since pre-pandemic till now. We have to reimagine how we deliver care, because care is being done very differently today, utilizing innovation and technology. And, I sit here and I think about, how much has changed in your profession since you started. And you talk about 5 days versus 6 weeks, and you talk about 40 to 50 minutes of treatment, which how much time is the treatment now for 5 days? It's like about 15, 20 minutes?
About 6.5 minutes. For
6.5 minutes.
Yeah.
Holy cow.
Yeah.
And I also remember you guys used to tattoo.
Just stickers nowadays.
Stickers.
So we in theory could still tattoo, but I can't remember the last time we've done it. So yeah, it's
like going to your pediatrician.
Exactly.
Get a
sticker. Yeah.
Can I get a sticker and a lollipop?
From the Starbucks that I go to, it's quicker than getting a latte. That's what I can say for sure.
Wow. So, that really is fascinating.
And at some point, it will be less expensive than getting a latte with how much more expensive that's gotten lately.
Wow. I mean, it is fascinating. And you sit here and you dream about what the future is going to look like. And I'm sure you're reading all the trade periodicals and the innovation that is being done right here at Honor Health. You're probably even on the cutting edge of some of the stuff that is about to come.
Absolutely. And I think the exciting thing for us is that having this affiliation with the hospital and having our own research division allows us to open up these clinical trial protocols. And they're investigatory, and in a way they're new, different ideas of how to supplement what the standard of care is. So it's saying, how can we take what we have today and make it better for the future? Good example is patients with brain tumors. So it used to be that if somebody had a cancer in their brain, they would go and have a surgery, and then they would wait somewhere from 4 to 8 weeks afterwards to then have radiation to help prevent that cancer from coming back. Nowadays, we're heavily involved in a clinical trial, and we're actually the #1 leading center in the United States for delivering this particular therapy, which is a form of internal radiation that's placed in the brain during the surgery itself.
Wow.
So the neurosurgeon removes a brain tumor. I come in at the same time, place some tiny radioactive seeds or particles in the brain. And what that's doing is it's immediately delivering a very focused, concentrated boost of radiation to that area to prevent the cancer from coming back. So patients don't have to wait for 6 or 8 weeks afterwards to heal up before they start their treatment. This has the benefit of getting immediate control, preventing these cancers from regrowing right away. And when you think of big hospital centers that somebody might go to for their patient care, you think of big centers in Houston, Texas, or New York City.
Right.
And you never necessarily would think of going to Honor Health or Arizona Center for Cancer Care, but it's fascinating to see that we're the number one leading accruer of patients onto these clinical trials in the whole United States. So I think, relatively speaking, we are small but mighty. We carry a big bat with that, and it's the concerted efforts of many people who are passionate and really care about cancer care and advancing it going forward to the future.
I love when you sit there and talk about the seeds, right? It's precision care versus that shotgun approach, right? Blowing everything up. You're getting right to the minute area that has the cancer, so you can destroy that.
Absolutely. And the way I tell patients this is that you could go squirrel hunting with either a bazooka or a slingshot, and why not use the slingshot if you can?
I love it. You're listening to Health Futures, Taking Stock in You. Steve, you know the drill. It goes by really fast. We're one down. We got 3 more to go. Steve Sckolnik's in the house, Arizona Center for Cancer Care. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. And if you're just tuning in, we're in our second segment here. I got Dr. Steven Sckolnik here in the studio with me. He's with the Arizona Center for Cancer Care. And we are talking everything about cancer, and more importantly, we're talking about breakthroughs. And if you missed that first segment, go up to our website at cypresshomecare.com. Click on the media button right below his radio show. You'll catch this one and many, many more. And Steve's been in the studio with me now for number 5 times, brother.
And so 5 times for me. How many times have you been in the studio, Bob?
Over 500. Over 10 years, man.
So you wear many hats. You do the studio, you do the show, you run Cypress Home Care.
I write a column, too, for the Jewish News. Yeah.
And you are a husband and a father. Do you think that your spouse and your children listen to any of your shows or read any of your columns?
Well,
could they be listening to this right now?
They could. My wife could be. The girls are probably working.
Yeah.
As I shared with you, I have a nurse, a speech pathologist, and I have a political reporter.
Mm-hmm.
Never a dull moment in their lives, and you couldn't find a more proud papa. I mean, it's really nice that each one of them has made their way, and I think I shared with you off the air, I've got a wedding coming up in November.
Exciting. Congratulations.
And then I got another one, Steve, in September of next year.
Well, this is good. This ensures that you have to keep working in perpetuity at Cypress Home Care. There will never be a time without Bob Roth there.
Yeah, the weddings, they're not so cheap. And I will say this, after the pandemic, all the prices are up.
Yeah.
Because everyone's trying to get married now. Mm-hmm. And no one could get married for like 2 years, 2.5 years. And what's interesting, you and I had a show back in October of 20. And I didn't go back and listen to it, but we certainly talked a lot about COVID and the pandemic. And the fact is that, with cancer, and it has to be really hard because people weren't going to see their doctor.
Yeah, absolutely. I think it was hard in a couple of ways. People weren't seeing their doctors. So what we saw a year or so, and this would have been even after we taped our interview, about a year and a half after COVID started, so maybe mid to end of 2021, all of a sudden saw this spike in more aggressive, more advanced cancers. So these were people that probably had some symptoms. They maybe had a cough or they had some blood in their urine, something where they said, well, I know this is not normal. I know this is bad, but I'd rather not go out of the house right now, or I don't want to be exposed to the healthcare system, or I just can't get in to see somebody in the healthcare system. So, not unreasonable thoughts, but then what we saw was these cancers, whether it be cancer or heart disease or neurologic disease, these things had a chance to grow and percolate and progress. And the challenging thing about that is that when anything gets to a more advanced stage, it involves more comprehensive, more involved treatment. It's more challenging to treat and cure. So we're still in a way dealing with the after effects, the repercussions, so to speak, of COVID. Even though it's 3 years out now, really, since it was first the thing. And, I haven't had a patient with COVID in probably 2 months in my clinic. It's off of a lot of our minds. We're still kind of dealing with the after effects throughout the medical world, but particularly in the cancer care world.
No doubt. And with COVID, I mean, we have treatments where we didn't have them back in 20. We had no treatments at all.
Yeah,
and
absolutely.
we didn't have, we were just on the throes of getting a vaccine back then. So, I mean, it's amazing how much has changed. And I just lost a client a couple weeks ago, and he was actually a dear friend, almost made it to 95. He was a couple weeks away. And, COVID indirectly got him. I mean, he had an appendicitis, and it blew up on him, and guy was a warrior. I was surprised they even operated on him. And he lived 3 weeks, but then he got COVID, and then he got pneumonia. Yeah. And, as we know, COVID can affect the respiratory system, and that just did him in at almost 95 and recovering from a surgery and having dementia. All those things didn't add up to a very good outcome for him in terms of the closing. So,
in the previous segment, we talked a little bit how our therapies have changed, how your home healthcare system has changed. And what was a big effect from COVID was the spread both amongst patients and providers of virtual healthcare, whether that be some kind of video visit or some kind of interactive care. And that has been a good thing and a bad thing in some ways. I think it's been good in the sense that it's opened up the availability for some patients who are maybe homebound or had other issues where they couldn't see their doctor, couldn't see them with the frequency that they wanted to see them. But then it's certainly brought in other issues where when you're just seeing somebody virtually, I hate to say this, and at risk of sounding old, you neglect the good old physical exam and the things that you might detect or see when you're feeling somebody's neck or examining their abdomen. You do pick things up almost every day. You notice a new nodule in the breast or a lump in the neck, and that prompts you to do something and take some intervention and further evaluation. So, I think that's one of these ways in which healthcare has changed, both for better or for worse. And I think this, what we call telehealth or virtual care, is here to stay. And I think it's something we need to learn how to incorporate, particularly in the senior community, people who might not have access to a video platform or an audio platform at home, or who might not have broadband internet. These are things that we need to learn to incorporate in ways that we can bring that into the home health system so they can have more availability and access to their providers.
No doubt. And Steve, you can only imagine, you see them in your exam rooms and you see them in your waiting rooms. But, for us to get an older adult who's like my friend, 94 years old, to get him to go in to see a doctor, that's like an all morning affair.
Yeah.
I mean, getting showered, getting changed, getting dressed, ambulating out to the car, and then getting in the car, and then getting into the doctor's practice, sitting in a waiting room, and then going into the exam room. I mean, it's exhausting for them.
Yeah.
And the fact is sometimes, they're being seen just to check on their medications, to see how they're doing with their Coumadin, and maybe need to have some labs drawn and stuff like that. So the breakthroughs that have happened in the sense that you're talking about telehealth, but also having labs done in the home, and even getting visits at the home, make it so much easier for people to age and not have to do that schlepping that really is very difficult for them, and they come home and they're exhausted.
And I think you make a great point about the obstacles to perfect or ideal healthcare. And a good example that you just brought up was a patient who's on a blood thinner, or a patient who has diabetes and needs to have their sugars monitored. These are things where traditionally 20 years ago, you had to come into the office for all of these. And now a large component of this can be transitioned to the home environment, where you can have a mobile nurse or a medical assistant come out and draw these labs, and can be run the same day. The next day you could be on a video or a telephone visit with your physician or other provider. And those are patients who in the past might have had, say, some issue with transportation. Maybe they didn't have a ride, or they couldn't afford a ride, so they would neglect that. And then they end up in the hospital 2 weeks later with an uncontrolled blood sugar, or an out of whack blood system with too thin of blood that causes a bleed. So all of these things, I think, is making the system more efficient, keeping patients out of the hospital, preventing them from getting to these kind of more extreme, significant healthcare crises. And that's our goal, not just in the cancer world, but throughout the entire spectrum of healthcare, make it more convenient for patients. I think we see that when we remove these barriers and these obstacles to care, patients do so much better. And what Ben Franklin said it best, the penny of prevention is worth a pound of cure, and we really do see that in the modern day healthcare system.
No doubt. And you talk about home care. I mean, we're in the home environment, right? So we're doing some stuff reimagining home care, but a lot of times it's the home environment that is causing some health issues, right? Maybe they're not getting their air conditioning. Maybe it's setting at the wrong temperature. It could be they're hoarders, and there's fall obstacles that are in the way. All those types of things. Well, you hear the music. We got a little Steely Dan taking us out in the second segment. Steve, you remember these guys? Come on.
Oh, absolutely.
Your dad does.
They were my favorite growing up.
It's halftime here at Health Futures. I got Steven Sckolnik here in the studio with me, Arizona Center for Cancer Care. Stick around. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we're in our second half here. If you're just tuning in, I've got Dr. Steven Sckolnik here in the studio with me. He's with Arizona Center for Cancer Care. They're got a great, strong partnership and affiliation with Honor Health here. And if you missed the first half, Steve talked about a lot of things that they're doing, especially on the innovation side. Please go up to our website at cypresshomecare.com. Click on the media button. Right below it is radio show. You'll catch this one and many, many more. So, Steve, second half. You're a pro at this. This is your fifth time. I know you have come with questions. So
Bob,
I don't know if I have the answers, but I will tell you that if there's a time where I can't do this show, you could easily guest host it.
Music to my ears. Well, we were just talking about how communication with your doctor or your healthcare provider has changed. It's gone from being exclusively in the office to now being partially virtual or even over the phone. And we all have this old classic idea of going in to sit in your doctor's office 20, 30 years ago and have 45 minutes of one-on-one FaceTime where the doctor is sitting there and examining you. And I think we all know that's not the reality today. Mm-hmm. What have your visits to a doctor been like today versus 20 or 30 years ago? How do you see it having changed?
Well, I mean, first of all, I can tell you that for me, I just recently had an MRI done on my knee, and I'm self-deprecating, so I always share this on the air here. I've got a little torn meniscus, not that big a deal, and I'm not looking to get it fixed right away. But I was able to do that without actually seeing my doctor.
Really,
which is really, really cool. My primary care physician.
Mm-hmm.
I mean, everything used to have to run through them, mm-hmm. right? You used to have to get doctor's orders to go get an MRI done, mm-hmm. or go for physical therapy. I mean, it's really unique today. Today, you don't really necessarily need to go in to see them. Mm-hmm. I was able to go and ascertain that. I mean, I told them I had mm-hmm. something going on, and ended up getting that. So what's interesting, too, when I got the results, because I have the access to the portal, I don't have access to the scan itself, but I got access to the radiologist's report. I knew exactly what I was dealing with because I could read it. And there were some terms that I didn't really understand. And Dr. Google is really cool because I could type it in and say, okay, now I know what I've got and what I'm dealing with. So I got all of that before I actually even had a consult.
Absolutely. And the internet, I think, is a beautiful and terrifying place all at once when it comes to healthcare. And, you're hitting the nail on the head, is that nowadays you can have a scan done. And since 2021, all of these imaging reports or blood testing or other diagnostic exams are available to the physician and the patient at the exact same time if you have access to some kind of online portal. So this kind of brings up the question of, is this a good thing? I think it's great that you had access to this, but
I'll answer that.
Yeah,
Come
was
on.
it a good thing?
Yeah, it is a good thing. I mean, first of all, you have to take control of your own health.
Mm-hmm.
And I think, we have to realize that as consumers, healthcare has become consumerized, and we have choice. Where in the past, I don't think we really had so much choice, or we didn't think we had choice. Mm-hmm. We always listened to our doctor. Our doctor said to do this or do that. It's okay for us to maybe get another opinion, or it's okay for us to do some research. It's okay for us to make a change. We are now, and we should be empowered to really be in control of our own health care. And you talked about the numbers. I always talk about that. What are your numbers? What do I mean specifically? Go get a blood test and find out what your numbers are. Find out what your cholesterol is. Find out what your A1C is. Find out where your testosterone is, if you're a dude. Mm-hmm. You want to know where things are. And guess what? Those results, they show you on the report if you're out of range. Mm-hmm. And that you're out of range. And then you can start to think about some of the treatments that you may want to do, or some of the changes you want to make so that you can bring those numbers back into line. And if you're informed, then you can actually sit down with your doctor and have a very thoughtful conversation, and it be more two-way rather than one-way.
Absolutely.
Because I think it was always one way.
And I think in the past it was much more of the physician said, I have the knowledge and I have the power, and I'm going to bequeath my instructions upon you and you will follow them. And I don't think that was a particularly effective way of treating patients, because it doesn't recognize the individual nature of each patient. For example, you just you described your findings on your knee MRI. Some patients might not want to have a surgery or a repair of that right away, versus in the past, the doctor might have just said, okay, we have this finding, you're going to go see this specialist tomorrow, and then it leads you down the rabbit hole, maybe to something that you don't want to do or don't feel that you need at that point. Mm-hmm. So now, by having this information, information is power, and you are able to make that decision and consciously be aware of it and do some research and find information about this online. Interesting example of what happened to me on Monday morning. I had ordered a scan for a cancer patient, and that had been done on Friday. And the result came out for the patient's electronic portal, and they had that access to that report on Saturday morning. I'm not there on the weekend, not reviewing it till Monday morning. We get into the office on Monday morning. We have a dozen messages from this patient of increasing worry and concern over the weekend because of a particular note that the radiologist had made, which turned out to be a benign finding, but understandably the patient was concerned and alarmed. And so this is this kind of loophole, or this donut that we find ourselves falling into, where yes, it is good to have the information, but I think all information needs to be considered in the context for which it was obtained. And the context for this patient is that that finding was actually of no concern and they were going to do just great. But I felt terrible that the patient was, really struggling
and had a horrible 48 weekend.
Hours, terrible weekend.
Terrible weekend.
And I would say that something like that happens every day.
Oh, I bet.
Almost every day. I might see 24 patients a day and order scans or blood work on almost all of them, and they're getting these results. And so what's happening is we're almost like the physicians are running on the hamster wheel, and it keeps spinning faster and faster as we do more diagnostic tests, more evaluation, the volume of that increases. And then, I feel that every patient should know the results of a scan within a business day. Mm-hmm. So at the end of every one of my days, much to the chagrin of my wife and our dog, I'll spend the last hour of the day extra at work, and I'll call those patients back and go over the scans. And it's meaningful to people to kind of close the book, close the chapter for what that study was, because it's anxiety invoking to not know what that means or what that result could have implications for them going forward. So, it's really interesting how what was really a subtle change in a law back in 2021 of saying, well, let's make all these results available to patients has been a double-edged sword in a way. It's had positive and sometimes negative consequences for these patients. So, I think it's really interesting to see what the evolution of that has been over time. So, something else that this can lead us into is almost all of our doctors' offices now have some way to message that doctor electronically, whether it's submitting a query on a scan result or a lab result or just sending a general message. Is that something that you do with your doctor?
I use email.
Okay.
And I send an email to my doctor. You probably know my general practitioner, Dr. Jay Friedman. I think
everybody knows Dr. Friedman.
And Dr. Friedman he's so amazing. And I say this, and I'm not here to really promote him and his practice, but I would hope that many physicians do the same, is that, if I call and he's available, he takes my call.
Yeah.
And if he's not available, he calls me right back, and he'll call me back that day. Yeah. And if for some reason he misses me, I'm getting a call 7 a.m. the next morning. And I mean, that's what you want. I mean, you don't want to have to wait, and your physician should be communicating with you. And I think electronically is fine. I mean, an email, like I get my labs and I'll send it to my cardiologist and I'll send it to him. Look, I think my LDLs look really good, but the HDLs I thought should be higher, and they'll read them and look, Bob, it's okay. You have great numbers, and you should be okay with that. Yeah. But it's nice to be able to get that reinforcement.
And you bring up an interesting point, mentioning your primary physician and your specialist. So in the oncology world, this is something that's extremely prevalent, where a patient might have 4 or even 5 subspecialists all working together on their team. Now, when we say working together, it doesn't mean that all these providers are in the same office or even the same building or the same hospital system, but they do need to share their thoughts, their information, and create one coherent plan. And that's one particularly important way that this electronic medical records has allowed data, information sharing, having results, images, labs, documentation, notes that are produced by one physician's office that need to be communicated to somebody else, having all that available at the flip of a switch. And that's really, really important, like I said, when you have 3, 4, even 5 doctors all working together for something of coordinated care, like a patient's cancer. And even just this morning, I saw a patient with a new cancer involving their tonsil. So this patient is going to see a medical oncologist, a head and neck surgeon, a gastroenterologist, a dentist, and a nutritionist.
Wow.
So in that hour, I sent an electronic message and received feedback and communication from all 5 of those other specialists saying, hey, everyone, this is what this patient has. This is the XYZ plan. What are your thoughts? How can we do this? How can we all come together in the same coordinated team to have this effort work seamlessly for the patient?
That was something that you could never do before. And that is just so awesome, Steve, that you're able to do that. And, I had a similar experience with my dad, and I've talked about my dad. I lost him in November. But when he was over at Honor Health, the EMR, Epic that they use, everybody has access to it. And I was able to get real-time information from his primary care physician right after labs or x-rays and stuff were done, which was fascinating to me.
Yeah, game changer.
We got a Marshall Tucker taking us out in the 3rd segment. We got 3 down, 1 more to go, Steve. You ready for the last one?
Ready for it. 4th quarter.
All right, stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009 Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and we are in our last segment here. I got Dr. Stephen Sckolnik here with me. He's a radiation oncologist with the Arizona Center for Cancer Care, and they have a unique partnership with Honor Health. They're doing amazing, innovative stuff. And if you missed our first three segments, go up to our website at cypresshomecare.com. Click on the media button right below its radio show. And, Steve, we got a chance to really talk about, how things were different since 2021 in terms of information being available to consumers. And as I shared with you, I think, healthcare has become more consumer-driven. And we, meaning the general population, needs to take control of your healthcare. You need to know your numbers. You need to be involved in your treatment plan and where you're at and your diagnoses. I think it's a very different world today.
Absolutely. And I think anecdotally you can see how the system has changed, how what used to be 45-minute visits with your doctor, 30 minutes or 15 minutes now, you might walk into your doctor's office and they're tied to a computer the entire time with their back to you, typing away, clicking boxes. And, some of that has been forced onto doctors. Unfortunately, it's kind of the system that has been built up around modern healthcare. But I think there's still this opportunity for patients to maximize what their healthcare experience is and what their relationship is with their doctor. And, I have patients or family members or friends ask me this question all the time of, how do you maximize or get the most out of what your patient visit is? If it's only a 15-minute visit, how do you kind of squeeze the most juice or extract the most important care out of that time? And what I always tell them is be prepared and make sure that your doctor is also prepared. So this morning I had a patient come in for a follow-up of their prostate cancer, and the most important thing that we have is the PSA level. That's a way to track the response and see how their cancer has responded. And this patient said that they had their blood work, their labs drawn last week. They didn't have a record of it, and we hadn't been sent a record by the lab system. So, we're sitting there and we're just catching up and talking, and we're able to talk about his side effects, the fact that he'd recovered and done really well. But I couldn't give him a true assessment of what his response was to his care. So even something as little as if the day before he had stopped by the lab and said, I know we asked you to send a copy of this over to my doctor's office, but can I just have a printed copy as well? Or can I just have a disc of my scan, something like that? So I think it's a two-way street. Doctors and providers want to be as prepared for the patient as possible. However, we're working within a system that, I don't want to say it's stacked against us, but if you think about a patient maybe getting their labs drawn at one location and a scan done at another location and seen by another doctor at a different office, it's hard to get all those records under the same system sometimes. So I think patients sometimes can be their best advocate. And I know this lies true in the home health world as well. I mean, you must see this all the time, right?
Oh, we do.
Yeah,
Absolutely. But I want to expand on what you talked about. I mean, I almost go back to, not that long ago where, I would go get x-rays or go get scans, and I'd go to see my specialist, and I would go to the place where I had it done and pick them up. And, pick up the disc or pick up the actual x-rays. And it wasn't that long ago.
Yeah.
And I mean, you really don't need to do that anymore. I mean, everything is electronic today. And, you should have it sent to you. I mean, I always make it clear, wherever I'm having the scans done, can you see that I get a copy? Now, most of the places like Smile and, Simon Med, they have a portal, and they'll give you access to it. You got to sign up for it, and you can read those electronically right through the portal.
Absolutely. And, it's funny that you bring this up about the x-rays, because for years in our office, we just renovated an office, and they said to us, well, do you want us to put in or keep the light boxes for the x-rays? What you think of your doctor holding it up to the bright box on the wall. And I said, I don't think I've used that in the last 5 years. And then just last week, a patient brought in a plain x-ray film for me to look at. And so instead I'm like an idiot holding it up to the ceiling, about to fall over because I'm leaning back so much. And but certainly I think that speaks to this preparedness, having your ducks in a row together, and not necessarily assuming that the doctor's office is going to have all the records, because these are disparate, separate locations for a lot of these things. And as medicine in a way has become more compartmentalized, it's not a given that everybody has all of these different records. And as medicines become more complex, we need to have all that together to generate or synthesize a good care plan for patients. So I think that's more and more important every day.
Absolutely. And it goes the same for us in home care. I mean, in order to get a good care plan in place, we really need to know what we're dealing with. We need to know what activities of daily living they're not able to do because of whether it be a physical or a mental or behavioral issue that they're dealing with. We need to know what medications they're on, what their diagnoses are. All of that needs to be upfront, and we can develop the best care plan once we have that knowledge.
Yeah. And it's so well documented how home health care can improve a patient's quality of life, improve their longevity, their functioning on a day-to-day basis. But you can't get to that point of putting in the right protocol or the right mechanisms for a patient at home if you don't know their medications, or if you don't know what their restrictions might be, or what they might need for assistance on a day-to-day. So, it's that feedback loop that needs to be closed at some point and have everybody in that same area. And you do bring up something that begs the question of, and I think everybody's felt this in a way, but what happens when you get lost in the system, so to speak? And, an example of this could be if I tell a patient, well, I think we need to have an endoscopy done on you. You're having abdominal or stomach pain and you're not having much appetite, so let's get this endoscopy done where they'll look down from the top and examine the stomach. And we put the referral in, whether digitally or send a fax over, and then the patient's sitting by the phone waiting and they're not getting a call. So everybody at some point has felt lost in this system. And because this system does not exist all under one roof, as much as we think of that conceptually being a good idea, it just hasn't played out that way. So, as a patient, with yourself or with your dad, had you ever had this experience where you just felt like things were getting lost and that things weren't getting done in this timely manner? I mean, and what have you done about it?
Well, I mean, you hit a really, really sore point for me. And if my dad were still alive, it was for him too. And I think it really begs to the bigger issue, and that is that we have a real shortage of healthcare providers. And, Dad saw a lot of different people for a lot of different ailments, whether it be a urologist or whether it be, somebody for his diabetes. But seeing specialists are really hard, and it's hard to get in to see them. And even, with a referral from, maybe your practice or even a primary care practice, there aren't enough rheumatologists.
Yes,
there aren't enough gerontologists.
Yeah.
They're just. I think that begs the biggest issue out there, and I want to make an appeal to our listeners. We need more people in healthcare. That's our future. It's not plastics like in that movie with Dustin Hoffman.
Yeah.
It's healthcare. We need healthcare providers.
Yeah.
We need more doctors. We need more nurses. We need more therapists.
Yeah.
And I think that's the really biggest challenge we have.
Absolutely.
Well, listen, you hear the music. We've got just a few seconds as we close, but I mean, I want you to at least, if there's a question I haven't asked, or if there's one lasting thought you want to leave our listeners, what would that be?
I think it is to be an active and engaged member of your healthcare team. It takes two to tango, so I always encourage my patients, ask questions, write things down, come visit frequently, utilize all the services that are available, because they're out there, and if we could optimize your care in any way, we should do it.
Awesome. Steve, it's great to see you.
Thanks, Bob. You too.
Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.